that. I wanted to be here to express my appreciation to the committee and staff for bringing us together and for the witnesses to join us. Not everybody is here. We've had a chance, however, to review some of the testimony that did get to us, and the record that is being built, I think, is very, very important to be able to shape and inform what we're going to be doing with climate change. And being able to focus on the human health aspect here, I think, is perhaps the most important and underappreciated area. Last week, we had our state epidemiologist, Mel Cohn, give a presentation in Portland where he outlined the public health issues that he's dealing with from climate change, from heat waves, the vector-borne disease, asthma, allergy, air pollution, chronic. It was a pretty scary litany of items that that they're considering from changes to physical activity to food insecurity, mental health. We need to be able to get the big picture together to be able to move forward on this. One particular area that I'm hopeful that the witnesses can help us focus on and supplement the record dealing with the problem of waterborne disease in particular. I mean, this is an area that is an international initiative. It's something we've been working on with my associate, Ms. Benner, since the Johannesburg World Sustainable Development in 2002. We've got the Water for the Poor legislation, but it's not being funded. And candidly, the administration as yet has not even assembled the plan that was called for under that legislation. And this is only going to be compounded if global warming continues and average global temperatures increase by just 1 degree. We're talking about 1/3 of a billion cases of waterborne illness, hundreds of thousands of people potentially that would be dying. There are opportunities with our assessment of global warming to actually to fight climate change, to actually improve human health. We've got some legislation, Dr. Frumkin, dealing with cycling and land use and transportation that actually not only addresses climate change, but actually has the potential of helping the human physical activity and condition. And we'll be moving forward with that. One aspect I didn't see, at least as we were reviewing last night, the testimony that had been submitted, dealt with climate change's impact on reduced biodiversity and missed opportunities for medical advancements. And I don't know if that's going to find its way into the record now or later. You know, we've had the testimony, we had that iconic picture of the polar bear, and some people are dismissing, you know, one more species more or less, but just thinking about the amazing capacity of the polar bear to fast for 150 days, maintain a relatively normal body temperature, maintain bone mass, give birth, but basically stop the other processes. The impact that could have for long-term human health is something that I'm hopeful we can get some help from you and from others. I'm going to stick around for as long as I can. I hope to get back.
Thank
I
you.
appreciate your leading us through this and look forward to hearing our witnesses.